Welcome friends on MuniMeterHealth, your source of learning about human heart and cardiology. Medical education, patient education is the prime goal here to improve the clinical outcomes. What is coronary stent? We'll briefly discuss today. Coronary stent is a heart device that's placed within the coronary artery which is clogged in order to prevent a heart attack from happening any further. So a damage which has possibly about to occur or has occurred, and you can actually get it to be prevented by putting the coronary stent. Here I am showing the color schematic of where the plaque or the stenosis or spasm or an obstruction or a clot in the form of obstruction is occurring within the coronary, assuming that this is the vessel. A catheter is placed into the artery upstream like this, and the catheter has a tip of at the tip has a balloon. That balloon is inserted in a deflated condition, and as soon as it arrives at the place where you want to have the obstruction relieved, the balloon is inflated. Now you have a balloon which is inflated all the way to the edge of the vessel wall. What happens next? You have pushed this obstruction all the way to the edge. As a result, now you have a free flow which is now occurring all the way, so this way you can prevent a heart attack. However, this catheter can stay in place. So what you need to do is now remove this catheter out and insert a mesh-like structure which is called the stent. It's a tubular, very fine metallic structure that is passed through again here. Now the balloon is out, remember, and now a stent is being placed. We'll show the stent in a different color. It almost looks like metallic spring of a ballpoint pen. Remember the old-fashioned ballpoint pens in the refills? They had little tiny springs. So that's exactly this mesh is. Now this mesh goes inside over this catheter, and now lodges inside to keep the artery patent or open. So this way the clog or the clogging will not occur. So now you have established a flow, and this metallic mesh will stay in for years so that a heart attack will not occur in that area. So the whole idea of putting the stent is wanting to make sure that either if the heart attack is happening, you can prevent the further damage, or to prevent a further heart attack from occurring. So coronary stents are placed in the coronaries which are the blood supply to the heart. Now let's draw the heart for a second. So just refreshing our memory quickly. Heart being here, you have your aorta coming off from the top, which is the main artery, as you know. And of course we'll close this here for a second, and we'll show the colors in this regard like this. Right here, this becomes your heart. Wow, that's bright and red. So now you have the arteries which will appear in this fashion, and we can draw the arteries arising from say here, and these are your coronaries. This becomes your LAD, this becomes your circ which goes all the way down there, and then you have your RCA, and each one of them, they have their own branches, if you will, and just like the branches from a tree, and they supply the heart. So the obstructions are clear that they will occur somewhere. Say the obstruction was here, or a clot was here, or a clot was here. So you can put these stents in these places, and these are called coronary stents. So the arteries are left patent so that the heart attack process is delayed or never occurs. Okay, so coronary stent are done in the cath lab. Just remember that. So they're all done in the cath lab, and of course I just showed you how it's done, when it's required, where are they being placed, and how it's being done. Okay, so just you have an quick idea about the coronary stent, and hopefully this was helpful. So stay tuned and come back and see us again on MuniMeterHealth.